Mayo actually didn't do HIPEC until 8 years ago. I joined the staff here at Mayo Clinic, Arizona about 9 years ago, and we were seeing patients who I thought would benefit from this kind of treatment. So I got together with some of my colleagues and some of the staff here, and we decided to open and start a HIPEC program. And ours was the first site out of the 3 Mayo sites to do HIPEC. And in the beginning, we anticipated perhaps maybe a handful of patients every year. But as word got around and people in Nevada, New Mexico, and the rest of Arizona knew that we were doing it, they started sending us patients because there was really no one else in the Southwest who performed this. And over the last 8 years, we have now become the largest center in the Southwest that does this. About a year after we started doing it here, my colleague in Florida, Dr. Bagaria, started doing HIPEC in Florida, Mayo Clinic, Florida. And then just last year, Mayo Clinic Rochester also came online and now is offering the procedure as well. The HIPEC is a very specialized procedure. It requires a lot of expertise on the parts of the physicians, but also postoperatively in terms of nursing care and coordination of care. And these procedures are typically done at very advanced tertiary care level hospitals. This is not the kind of procedure you'd get from someone in private practice. And the Mayo model is perfect for a procedure like this because it's multidisciplinary. We consult with all the colleagues, and we have the resources available here to do it and also to take care of the patients afterwards, which can be quite challenging. The outcomes in general for the right patient are pretty good. One of the biggest concerns about HIPEC, and a lot of patients will Google HIPEC and come to us with this, is the complication rate after surgery. Traditionally, it was quite high. Some of these operations can go on for 10 hours all day. The patients can spend weeks in the hospital and have significant complications. But as the field in general has gotten experience with HIPEC, and as our own experience mirrors this, the complication rates have gone down. In fact, we have looked at our own results and published them, and we have some of the best complication rates in the country. And that's just a testament to the staff and the people taking care of these patients. Now the main concern is, well, how effective is it? And we do know, again, from studies that we and others have done, that for certain types of tumors, appendiceal tumors that have spread to the abdomen, mesothelioma that arises in the peritoneum, HIPEC is easily the most effective treatment. Prior to HIPEC, almost no one survived these diseases. And now for mesothelioma, the long-term survival is about 50%. For appendiceal cancer, it's about 60%. Other types of tumors like colon and ovarian cancer, the success is not as good, but it's still better than zero, which is what it would be if we didn't have HIPEC.